Why? Well, before it's going. If you change your mind, tell us. Yeah?
A pleasant good morning to all our Emonews followers, viewers, and it is Thursday, November 14th, and it is World Diabetes Day. As most of you can see here on the live, this is our doctor, Dr. Ricketts, and we are here at her office at Hasbro Medical in Roseau, and we'll be speaking with her regarding breaking the barriers and bridging the gaps for World Diabetes Day, today, November 14, 2024. Good morning, Dr. Ricketts, and welcome to Emonews.
Good morning, Emonews, and thank you very much for helping us spread the word about diabetes.
Okay, so today is World Diabetes Day, and we are here because you plan on raising public awareness about this chronic non-communicable disease, and it is increasing in public health. It's an increasing public health problem. So we are here this morning. We're going to speak with you and hear what you have done for the public for World Diabetes Day. So tell us what your plans are from your office.
So today, November 14th, is World Diabetes Day, and every year this date is observed as World Diabetes Day because it is the birthday of Frederick Banting, who was one of the two people, together with Charles Bess, who discovered insulin in 1922, a life-saving treatment for diabetes up to today. So every November 14th, we observe World Diabetes Day. However, the whole of November is observed as Diabetes Month, and it is to raise public awareness about this chronic non-communicable disease, which is increasing in prevalence as we change our lifestyle, and this impacts on our health. And so from my office today, we are going to look at the complications of diabetes in the eye, known as diabetic retinopathy. The retina is the nerve lining inside the eyeball, is the nervous tissue that take the images that you see from your eye to your brain. And if this tissue is damaged, then it impairs your vision and it can even get you blind. Diabetes is the leading cause of preventable blindness in our working age population, 20 to 74. And as we hear preventable, it means that we can stop it from getting you blind. And how do we do this? Well, we screen for it. And screening means that you are looking for a disease that the patients don't even have symptoms yet about the disease. And the rationale is that the earlier you detect it and treat it, the better the chances of preventing diabetic retinopathy. So today we are going to, first of all, check the patient's history to see how long they've had diabetes, because we know the longer you have diabetes, the greater the risk of you developing diabetic retinopathy. Then we're going to do your vision, check how well you are seeing, and check the eye pressure. Following this, the pupil will be dilated and the patient will be taken to the next examination room, where they will have a photograph taken of the retina. I will review the photograph, and if it shows that they have retinopathy, especially involving the macula, the most sensitive part of the retina for vision, then they will have what is called a OCT, optical coherence tomography, which is like a little CT scan showing you cross sections of the retina. And this will let us know whether there is any swelling of the retina. If there is swelling of the retina, then we will have to proceed to treatment, which is in the form of laser treatment, which can be done here in this office. The other form of treatment for this is intravitreal anti-VEGF injections. And I do these injections, but I do not do it here. I go to the surgical facility at Premier Medical Services at Goodwill. So in a nutshell, this is what we are doing today, trying to identify patients with diabetic retinopathy. And at any one time, we know about 30% or 3 out of 10 diabetics will have some form of diabetic retinopathy.
Great. Thank you, Dr. Ricketts. So really and truly, you are here to empower diabetics to manage their disease through your education, quality care that you're making available and affordable, accessible, and equitable to all diabetics. But I'm learning that you have some free activities today. What is it that you're doing for free today?
Okay. So usually in my office, when you come in, you have to pay for your eye examination. If I determine you need to have OCT, then you have to pay for this. And if you require laser or intravitreal injection, you have to pay for this. But today, the 14th, we continue on the 21st, as next Thursday, and 28th, the Thursday after that, to provide all the services except the injection, free of charge. So our patients today are really getting a good deal in getting treatments free of charge that could help them avoid blindness, preventable blindness.
So the free services which you identified are only for today. Can someone call now to make an appointment just for today to come in, or can persons walk in for these services today?
Well, yes. Well, there are a fixed number of persons we can see today. And I think we're at our quota already for today. However, we have other opportunities on the 21st and on the 28th. So they can call the office to be booked, to be screened as we are doing today.
Okay, what contact number for those on the live who may want to call for a booking for the 21st and the 28th of November for some free services? What number can they contact?
So it's 275-1665 or 449-8565.
Okay, wonderful, Dr. Ricketts. So we are going ahead with our process. Are we going to show the viewers how it's done with the permission of our patient?
Next.
Okay. So for those of you on the live, we just want to remind you that we are here. It is Diabetes Month. And then today, November 14th, is World Diabetes Day, where they're breaking barriers and bridging gaps. And the aim is to raise public awareness about this chronic non-communicable disease and increase public health problem. And the purpose again is to empower diabetics to manage their disease through education and to make quality care available. So we are here at Dr. Ricketts' office, and for today and the 21st and the 28th of November 2024, there will be free screening on certain diabetic retinopathy, optical tomography, and free laser treatment for diabetics, those who are identified as needing it from the screening sessions. So thank you for joining us. We will be right back, and stay tuned. For those of you on the live, you can call the office and make your appointment. We'll be back live with Dr. Ricketts in a bit. Thank you for viewing. Stay tuned.